Okay, good afternoon, doctors. Welcome to today's program for Spinal Kinetics, where we give you webinars on specific topics a couple times a month at least. Today, I'm really happy to have the founder of our company of Spinal Kinetics, Stephen P. Brownstein. He's a medical doctor, he's a radiologist, he's a pioneering medical radiologist. Dr. Brownstein has understood stress radiology and the importance of ligament testing almost from day one. He, as the founder of Spinal Kinetics, he's the founder of Dynamic Medical Imaging, which is an imaging service that produces upright weight-bearing MRI facility services in New Jersey. He's been an avid proponent of spinal ligament injury testing, excessive motion testing. He understands that the medical model has not always understood this, and that's why he is a pioneering medical radiologist. Dr. Brownstein, we are so happy to have you on today.
Thank you, Jeff. Proud to be here. As Jeff said, I'm board certified radiologist for 40 years. I also have donated my teaching library to Palmer College, and I'm also honorary fellow American College of Chiropractic. Probably about 12 years ago, I was introduced to spinal ligament injuries and testing, and I got it right away. We became the first center in the United States to have the phoner upright, digital motion X-ray, and CRMA under one roof. So I've become the leader in dynamic imaging and publishing along those lines. We've published 3 articles in the Journal of Orthopedics and Rheumatology, and the first one, the evaluation of spinal ligamentous injuries using computerized X-ray interpretation, is a sentinel article that showed that radiologists cannot pick up these findings of ligamentous laxity using standard technique. One, most of them don't look for it, and even if they do, unless it's measured using a specialized software that we've developed, CRMA, they won't be able to diagnose this. So that article I'm really proud of. It's also being cited in numerous articles. So the other article is about the simple spinal sprain is really not that simple. The understanding or misunderstanding that it's just a soft tissue injury, 4 weeks, 12 treatments, and the patient's healed, is so false, and so it's a lie. And we're in the process of dispelling that myth, and we're proud to be the company that has solved or in process of solving this problem. Jeff, you want to go to the next slide,
Yes,
please?
That's fantastic. That's just to clarify that point too, doctors. When Dr. Brownstein is saying this, what he's doing is he is putting this out into now not just chiropractic, but the medical world itself and the whole health industry, so that this becomes a standardized procedure. Go ahead, Steve.
So the CRMA is the Enigma code for spinal ligament injuries. It helps identify the site and location and severity of these injuries, and we're proud to be the leaders in that. Jeff has put out numerous articles and slides. Spinal ligament injuries are #1 cause of pain and disability in the world, but they're not being diagnosed. 2 million automobile accident patients have permanent injuries, and a large percentage are spinal, and that's because we're not properly diagnosing these patients. And CRMA should be spinal ligament testing. CRMA should be done on any patient that you suspect having spinal ligament injuries. Stress radiography and measurement of those stress radiographs are the only way to make that diagnosis. And it's critical because there's articles like this one that shows these patients 100% go on to have chronic pain. And we have to stop that cycle, and we can, and we will. Next. So the two ligament injury biomarkers are for excessive motion and disc herniation. We have X-rays that are great for evaluating abnormal forces, both compressive and translational and aberrant motion, and MRI, which is great for evaluating disc disease. But discs are only 23 of the 220 ligaments, and if you just do an MRI, yes, you can diagnose disc herniations and bulges, but majority of the time you're not going to diagnose spinal ligament injuries. In fact, if you look at a cervical spine MRI report, the first thing they say is C2-3 disc. They don't talk about the craniocervical junction and the ligaments and ligaments in that area. So again, you have to use a combination of stress radiography and MRI to get the full picture of all the ligaments injury in your patients.
And Steve, just to be clear here, basically, just so everybody's clear on the webinar today, what you're saying, and we've had so many discussions about this, so I just want to clarify, because sometimes we'll have doctors of chiropractic on the webinar today, and sometimes the language is a little bit different, but excessive motion is not picked up on MRI. It's picked up on X-ray, and disc herniation is not picked up on X-ray. You've been a radiologist for 40 years. Nobody picks up disc herniations on X-ray. So they're two completely separate imaging studies, and they're two completely different imaging biomarkers, correct?
Correct.
And both are important. Go ahead.
And the other important difference is, CRMA is totally objective. An MRI report is somewhat subjective as far as, two radiologists looking at the same MR may come up with a different interpretation. So it's important that you, as a clinician, you'll have a better chance of deciphering what the MRI report means by having the benefit of having stress radiographs and a CRMA, as well as your clinical evaluation, that you can now incorporate or interpret the MRI through the lens of your clinical knowledge to get the most out of the MRI as well.
Okay, perfect. And of the two, I know we've talked about it. Look, there's no question about it that disc herniation is bad. I mean, you can have a serious bad disc herniation, but if you looked at the two, and Steve, we've talked about this a lot, that the excessive motion is generally more problematic. If you look at what they do surgically, they fuse excessive motion. If you have a disc herniation, it's a microdiscectomy, correct? So of the two,
correct.
That's fine. Okay.
So the most important thing as far as the radiography is to get great films. And if you have any problems as far as that, we have Tanya, that's our technologist at our office, and she's great in helping give tips how to get great films.
Right, but the other big thing, Steve, here is that you can't find, you're not going to get excessive motion on MRI. So it's done with stress radiography, and doctors, it just means you got to have good stress views. And if you don't know what Dr. Brownstein's saying is, if you don't know how to shoot good X-rays, we have a Mayo trained, right out of Mayo Hospital, trained rad tech that's put together a very, very simple packet, whether that's, it's for you or it's for an imaging center, to be able to shoot these images correctly, because, Steve, as we've talked about, the biggest thing that we need is we need good images. But the main thing that I think Dr. Brownstein is trying to say here is that you can't find this anywhere else except for on excessive or on X-ray. So it's really easy. You just shoot the X-rays, and then we get the report. And Steve, and one of the things I want you to comment on is the fact that we have, how significant it is that we have 2 board certified radiologists now on every test.
It's it is so important to have objective reports. And by having two board-certified radiologists look at it, one to plot the points and the other to verify the point placement and sign off, is great.
Okay, Steve, but here, what I want you to, you've been involved with a lot of radiology services, right?
Correct.
Okay, good. So I don't want you to be humble here. I want you to be really letting this public that's listening today know just how hard it's not easy, which is why we're the only national service in the country that does this. We have two certified radiologists. We don't have like somebody who's not certified as a radiologist. We don't have a person off the street. We have two certified radiologists doing these studies. And just kind of comment on, that's not an easy thing to accomplish in the radiology world.
No, it isn't. In fact, it's the only test that I know that has two board-certified radiologists signing, involved in the test.
Correct. Correct. So,
and it's important. We're different than other companies out there, significantly different in that I feel 100% that these tests should be done independent of a practitioner's office, not in the practitioner's office, because the biggest problem in getting paid is the insurance companies view anything that you do in your office as being biased, and to have objective documentation of spinal ligament injury is invaluable for, one, you properly treating the patient, and two, getting paid for the time that you spend, treating the patient. And so, we're not DXD software, not DRMA software or Posture. They may all be great software programs, but again, this test is so important that to do it yourself it doesn't make any sense to me, because you want objective documentation of your patient's injuries.
Right.
And
absolutely. And Steve, we've talked about this before. If you as a medical doctor, if you look and said, look, to an outside party, I'm making a referral for surgery directly based on findings that I found in my own office, as opposed to based on findings of a third-party radiology service. Or let's take it even further than that. We've had webinars on return to play parameters. And let's say that you're a doctor and you're treating a major sports figure, and it's found that they have a severe ligament injury caused by excessive motion. If they were using some software in their office, do you think it would be credible, or anybody would look at it as credible with the findings, as opposed to having board-certified radiology report?
That's correct. Again, if it's available to you, we're a phone call away to get you started, and you have the accessibility of educational programs as well, marketing programs as well, that to me, if you're not doing it, you should be doing it, and there's no reason why you shouldn't be doing it on any patient that you suspect spinal ligament injury, whether it's a motor vehicle accident or a kid's hurt playing soccer, does a header, or a kid's playing football, and wherever the mechanism of injury, if you suspect spinal ligament injuries, definitely you need to do stress radiography and have an independent evaluation via software such as CRMA doing it.
So what Dr. Brownstein and I have spent a lot of time, when he talks about independent marketing, that's not through Spinal Kinetics. That is not, Spinal Kinetics is a diagnostic company. It's a national diagnostic service. It doesn't have educational services. What he's talking about is a smart injury doctors program that I developed with another company to help doctors get educated in this. You've seen that before. And Steve, what I'm going to do is just kind of jump in here. Doctors, this is how easy it is. Dr. Brownstein's been a pioneer in helping doctors to get this diagnosed. So the number one misdiagnosed or non-diagnosed condition in the country is a ligament injury. A patient comes in, we don't care at Spinal Kinetics whether they've had, it was due to an auto injury, it's due to a work injury, it's due to slip and fall injury, it's due to domestic violence. We don't care. If there's an injury, you have to derange the body part. So the patient comes in, they all do a consult, you all do some type of a diagram or something that says, where's the pain, where's the problem? That should lead you right to a specific spinal level. Now, in your motor or sensory testing, which we know you all do, it leads you right to a level. Now, here's the beauty of that. Each nerve is associated with where it comes out with a motion unit. Dr. Brownstein knows this because this is why we actually, with the radiologist, what we're now, once you have that, the very first thing that you should be asking as clinicians is there damage here? Now, there's only two forms of damage that Dr. Brownstein's already talked about. There's either excessive motion that you pick up on flexion extension studies, or there's a disc herniation. Those are the two ligament imaging biomarkers that Dr. Brownstein talked about earlier. So as soon as we have these findings clinically, these lead right to a level for the super top elite injury doctors today in the market, the front of the bell curve, which is what we want to be working with. They know immediately we should be checking for these levels. Now, they send out, just as Dr. Brownstein said, take great films, you send us in the reports, and now you actually get the findings with a certified independent unbiased medical radiologist that tells you exactly how torn up these areas are. That is the beauty of it. You also have, of course, the upper cervical specific. And Steve, what I want you to talk about now, so doctors, that's what actually happens. That's our role as Spinal Kinetics, and the pioneering role that Dr. Brownstein played is bringing radiology into this, bringing this test into this to assist with this right here. Good. Do we have damage? Remember, you can't damage the human body without deranging it. So how badly deranged is this? That's what Dr. Brownstein has helped to initiate, is a company of board certified medical radiologists, 2 on each test, that actually do this. Now, Steve, we're starting to have some changes in the ACR. You stay up with the American College of Radiologists. And slow as it may be, there are changes, and I want you to speak a little bit about how what you've done with your research is helping, because it's getting cited and it's starting to make a change. Go ahead.
Yes, and you know, the fact that we've published the article that, you know, radiologists can't make this diagnosis, more and more radiologists are starting to get involved in our company or other companies, and as far as being educated, and also start doing these procedures in their practice. So I'm really happy that we're making an impression, you know, driving this information down the you know, through the radiologist to get more involved in these patients.
Now, Steve, one of the clarifications, though, because again, I do this enough, so I know where clarifications need to be made. So a radiologist with their current PACS system cannot do these types of studies, can they?
No.
Okay, so doctors, what that means is most radiologists read your X-rays with a PACS system. They do have some measurement tools on those. And so what you can see is, if you have something visible, you may see the radiologist says, hey, there's a 2 millimeter translation here or whatnot. But, and Steve, you would agree, unless the radiologist has measured each and every level, they do not have a system. They don't have a software in place to do this. And Dr. Brownstein, if you could just speak to the fact that what's so significant about this is that they can't do it with their current systems. That's why you brought this into radiology and formulated spinal kinetics in the first place.
That is correct, Jeff.
Okay, good. Okay, no, that's fine. Like I said, I just wanted to make some clarifications. And now, if you could talk about the things that you're working on, that we're working on, but you're kind of the lead on now, about publishing a series of more. I mean, you've already started the conversation with radiologists cannot find these things. So doctors, what that means is when you have a radiologist that reads your x-rays and says, well, there's no instability here, or there's nothing, what they're saying is visually they don't see anything. Dr. Brownstein has already been a key person, the key lead on being able to get us to publish the fact that you can't see these things. And Dr. Brownstein, you're now going to embark upon 3 more where you're talking about diagnosis, you're talking about exam, and you're talking about correlation between MRI and excessive motion testing, and bring the 2 modalities together. Kind of give an idea of what the future is and what you're looking at publishing.
Well, Dr. Cronk's developed a great protocol or algorithm on how these patients should be evaluated. So the first article that we're going to be publishing is based on diagnosis that these spinal ligament injuries can be diagnosed, and we're going to address why they aren't being diagnosed. We're always taught first day in radiology, you see what you look for what you know. So more clinicians are going to know that they're supposed to be evaluating these patients through stress radiography. More radiologists will know that they have to use a specialized computer program to do these tests. So the first article is the why and the how. The second article will be on how we correlate the clinical findings and the stress rate and the CRMA findings to identify the cause of the pain. And the third article is basically tying together the CRMA and the MRI findings in an integrated report where now we're evaluating all of the spinal ligament injuries, both by using the CRMA and MR findings. So we're addressing all 220 ligaments as to their, whether or not they're injured and the severity of their injury. So that's the three-part article, or 3 articles that we're in the process of preparing for publication. Probably be published within the next 6 months or so. But I'm looking forward to that. I think then we'll have all the information out there for both clinicians. We're also in the process of getting the message out to both attorneys and to patients. So that's the next year. Next year we're really going to be busy making sure that more people, more patients, more attorneys know that spinal ligament injury is the #1 cause of chronic pain, and we need to eradicate the chronicity because it's costing, billions of dollars, and the quality of life is not what it should be for these patients that have been injured.
Absolutely, absolutely. So again, what Dr. Brownstein is talking about is he's talking about, and I just laid a slide in here to kind of give you an idea or a visual. This is right out of WebMD. I'm sorry, this is right out of Medscape. These are the common symptoms listed for a spinal ligament injury. Now you're going to see these are pretty much if you're a doctor of chiropractic, or you're a musculoskeletal medical doctor, you're a physiatrist, you're a physical therapist, these are the things that you're treating, right? So you look at these things and you say, okay, great. We take these examination procedures now, and we know, great, if we have a C5, C6 nerve, we know where to correlate, what motion unit to look at to support and substantiate the spinal instability. That's going to be the process of 3 research papers that Dr. Brownstein is talking about to standardize this. There's no patient in the country right now, and when we're on these webinars right now, it's not just doctors. There can be doctors, there can be attorneys, and doctors, there can also be patients on these webinars, patients that are interested in their own health because they've had to be. because they've been non-diagnosed, because they've gone through horrendous things simply because they could not find a doctor to understand what was causing their problem. They've been actually classified as a psych case or a head case of a malingerer, simply because they could not find a doctor that could actually clinically tie a physical cause to what they had. And that's the purpose of our company. And Dr. Brownstein, if you would kind of speak, I know I speak about this, but speak about the fact that yes, if they want more information, get on our podcast. When I say our podcast, this is not Spinal Kinetics podcast. It's a podcast by myself on relevant topics in the market that we run into every day. So Dr. Brownstein and I have been doing this for a long time. And so whatever I run into in the market, I produce a podcast on. Short, 8 to 12 minutes. You simply say, hey, Alexa, play Smart Injury Doctors podcast, and it'll play for you. You buy a Echo Plus or an Echo in your home, in your office, or you sign up for Apple Podcasts or whatnot to get more information on this if you need it. Doctors, what I'm going to tell you right now is that if you're not signed up for our services, sign up for our service. Call us today at 877-508-9729 or visit us at thespinalkinetics.com and sign up, register for us, elevate your practice to a level where it should be in the front of the bell curve, totally in front of the bell curve. Now, I'm going to open it up. I meant to have Q&A at this point, or a big Q&A right there. Dr. Brownstein, at this point, unless you want to say anything more, I'm going to open it up to questions and answers. To some Q&A, because we try to run right about 30 minutes, which you did great. We're right at 27. So doctors, if you have any questions at all, just go ahead and ask away. Sorry, I see there was some sort of double speaker, somebody had problems with double sound. Sorry about that, if you had that. Okay, Dr. Brownstein, yeah, I have a question. Do you anticipate CRMA being a standard in radiology for ligament assessments?
Yes.
Can you elaborate on that a little? I mean, basically, yes, because there's a void, right?
Well, yes, meaning that if we're bringing it to the attention of the public, and the public's going to demand the clinicians to evaluate for this, and the clinicians are going to demand, if I do stress radiographs, that they're accurately measured via CRMA. So it's going to be a combination of patient-driven situation where as patients become more knowledgeable of why they're having pain and what to look for in the clinician, make sure that they evaluate for the spinal ligament injuries, possible spinal ligament injuries. So I feel very certain that spinal ligament injury testing with computerized radiographic measurement analysis is going to be a standardized protocol in the near future.
Perfect. So I have a attorney on the call today, and his question is, where should I send my clients to get these X-rays done around Riverside, California? Doctors, if you're listening today, we have an attorney who's online. You call Spinal Kinetics if you have someone that you know in the Riverside, California area. So the answer to the question is simply you can get the X-rays taken anywhere, but what you'd want to do is find a doctor that's using Spinal Kinetics already, and they would do that for you. So doctors, if you know anyone around the Riverside, California area, we will call them, we will set them up. We're getting more and more calls and more reaches like this from attorneys who understand the seriousness of this injury. As a matter of fact, this attorney I'm familiar with who's on the call today has done incredibly well with this type of testing. The biggest problem he has is finding doctors that can actually do this testing. Sorry, my Siri's picking up on my cell phone. So if you know somebody, call into us and we will hook you up, the attorney that's online today. Okay, so here's a question. Okay, so how do we objectively talk about cranial vault instability when there are no guides for that region, only for the C2 and below? Okay, good. So I'm going to take that question for you, Steve. That's an easy one, totally easy one. So what the doctor's asking about is if we have a craniocervical junction problem. So if we have this problem right here, he's asking about, hey, the guidelines, the AMA guidelines only talk about rateability of C2 and below. Well, that's not true. They only talk about alteration, motion, and segment integrity of C2 and below. So if you have ligament instability and it's causing pain, you could rate it for pain. If it's causing headaches, you could rate it for headaches. If it's causing abnormal range of motion, you could rate it for abnormal range of motion. There's a number of different ways that you can rate. If you're talking about a C1 nerve problem, you're talking about the greater or lesser occipital nerve problems, you can rate those nerves and the nerve problem associated with it. So just because the AMA does not have alteration, motion, segment integrity at this level doesn't mean that you can't rate it. So that's the answer to that. I hope that helps on that question. All right, I have another question. Okay, this is a question of a doctor. I have a digital X-ray motion unit in my office. Will you analyze those studies for people with equipment? I'm going to take that one as well, Steve. What you would do is you would call us, because most of the time what you have on digital motion X-ray is you've taken X-rays first. Most providers that have a digital motion X-ray unit have digital motion X-rays that they've taken that drives them then to take the digital motion X-ray. What we want to do is we want to do your X-rays, because your X-rays are easier and they're in a format called a DICOM format that your DMX is not. So it's far more accurate to do it on your X-rays than it is to do it on your DMX. Now, whatever is on your X-rays is on your DMX, and now you're visually showing. So it's a very easy 1-2 punch, if you will, but most providers that have the DMX have the digital X-rays. We want to do the service on the digital X-rays. And what you would do is, for more information or more understanding of that, you would call into Spinal Kinetics and set up a time with me to do a further explanation on that than just the 30 seconds that I just gave you, because the more that you understand it, the more you'll understand your modality as well as the modality that you probably used in the first place, which was the X-ray, and how they really tie together and how you can really do a great job in your community with those two modalities. Dr. Brownstein, have you been deposed on this topic, and are the depositions easy, etc.? They want to know about have you been deposed?
Yes, I have. And I can tell you it's a lot easier to be deposed on CRMA report than an MRI report, because CRMA is objective, there's numbers, and it's very hard to argue when you have objective numbers showing the pathology. Whereas with the MRI, I read the films and then they send it out to an IME radiologist, and he says, well, I think it's a bulge and not a herniation, and basically it's one radiologist's opinion versus another. CRMA, you do not have that at all. It's the simplest deposition I've ever done. It was on a CRMA case. I went to New York, did my thing, and I was off the seat in about 30 minutes. It's so beautiful to be deposed on CRMA. Like I said, it's the easiest deposition I ever had, and once you understand it, it's going to be the easiest deposition if you depose on it for whoever does it.
No, that's fantastic. That's fantastic. So I'm just waiting to see if we have any other questions. I don't see any more questions coming in. Oops. So let me just give the last, let you type in any other questions that you may have, and end by saying again, if you have not used our service, you're not using our services currently, or you're the doctor with a DMX that wants more information, call us at 877-508-9729, or visit us at These Spinal Kinetics. Put in a hey, contact us form. Tell us when is the best time to contact you, and we'll contact you and we'll get you started. We have had significant increases based on everything that we're doing on the market. Dr. Brownstein, I seriously appreciate your time. I know how busy you are. I appreciate your time, taking the time today to come on. And I don't think there's any other, I'm not seeing any other questions. So if you have any, if you have any other things that you want to, I was just searching there see if there's another question. Is there anything else that you want to say in parting? And if not, we'll end at this point.
Jeff, the only thing I'd say is if the people the doctors or attorney on the phone on this webinar has any other suggestions of how I and our companies can help them, just let us know.
Okay, fantastic. All right, doctors, thank you very much for your time. I know you're busy. We try to keep these short, sweet, and to the point. We'll see you on the next one, and make it a great week. Thank you.